Welcome everybody, a very warm welcome. My name's Jane Hill, I'm the CEO of Ovarian Cancer Australia, and I'd like to begin by acknowledging the traditional custodians of the lands on which we're meeting today and pay my respects to their elders past, present and emerging. And for me, it's such a joy to be here. I was complaining to David Botel, I think, some time ago, lamenting the fact about we had to spend so much time getting to meetings all the time. And David Botel, being the futurist he is, and I might say this was about 4 years ago we had this discussion, and he said to me, Jane, he said, you've got to get on this thing called Zoom. Little did we know about Zoom. Anyway, it's so good that we are here, everyone's together, we can have the conversations, hear about new things, meet our friends and make new friends. So thank you all for coming today. We have a very compelling program for you today, and I'd like to thank the speakers for taking the time. I know one speaker was still at their presentation at 3 a.m. This morning. So they're very hard workers, so thank you to the speakers. I'd also like to thank the organising committee, and they are David Botel, Anna DeFazio, Dale Garsed, Nivi Rajadevan, Vanessa Alford and Sue Hegarty. So we wouldn't be here without their work. So Ovarian Cancer Australia, our vision is to save lives and that no woman with ovarian cancer walks alone. And our priorities are very simple. We exist to support the women and the families that are going through ovarian cancer. And secondly, we want to advocate for a better future state for ovarian cancer. And some of our advocacy priorities include advocating for better treatments for women with ovarian cancer, reducing variations in care, and getting more funds invested in ovarian cancer. And I want to make a shout out to the Ovarian Cancer Australia team that are here today. I can see there's quite a few in our teal shirts, and most of the staff here today are clinical nurse consultants, and they are helping at present about 700 women with ovarian cancer across the country through our teal support program. So they're doing some terrific work there. So I encourage you all to pop out to the Ovarian Cancer Australia table and meet some of our wonderful teal support nurses, and also find out about all the resources which are evidence-based and available free of charge. Some of them we have here today, but you can get them on our website and order them, and as I said, free of charge, all evidence-based. Also today, thank you to Professor John Zalsberg and his team for being here from the Clinical Quality Registry. They're here, and it's been a delight to work with the registry people over the last 6 years. And I know many of you have been very involved in getting the registry to where it is now. So thank you. And also a shout out to AstraZeneca and GSK. Thank you for putting the funds in to sponsor this program today so we can make the registration free of charge. And it was somewhat sombering for me when I joined Ovarian Cancer Australia 8 years ago. And I was told at that stage that treatments for ovarian cancer had not very much varied in 3 decades. And I think, wow, in these 4 years, we have come so far. And I'm really excited to hear today about what the future brings. And, you know, people are already starting to just mention the word cure, which was not something that we were thinking of particularly 8 years ago. So it's going to be really interesting to hear what our speakers say today across so many different areas for ovarian cancer. So before we fire up the engines and get a start, just a reminder, can you put your phones on silent? And the Wi-Fi details are in your handbook. And if you do feel the need, we do have hand sanitizer and masks available. So we're now on the runway and we're ready for the takeoff. So I'd like to welcome our legendary Professor Michael Freelander to the stage as the chair of our first session. Thank you.